Daisy, good to have you again on the show with One Stop Medical. You know, we were talking a little bit about some of the services that you provide and the clientele that tend to come your way. So just briefly, let's just touch on that before we get into the meat of what we're going to discuss today. Who are some of the folks that you open your doors to?
Yes, absolutely. So we open our doors to patients that have been involved in a motor vehicle accident, a slip and fall, or a work injury. As long as they were not at fault, we open our doors to them and make sure that we can help them.
You know, and going along with that line of thinking, a lot of times if you know you're not the one at fault, you're saying if you go the traditional routes of where you would traditionally go for treatment, that you might kind of come up against some stumbling blocks or some brick walls. Let's talk a little bit about that.
Yes, so what happens is usually when the patient gets involved in a motor vehicle accident, they feel that they should call their primary doctor or their urgent care, which is obviously the first step that most of us would take. And unfortunately, they get turned away sometimes because a lot of these providers are scared of getting into they're not scared, they're just not, it's not their practice, it's not what they want to do, getting into depositions and the legalities of motor vehicle accidents. Our doctors specialize in that. So when they get turned away, patients just don't know where to go. They don't know what to do. And we want to be that resource for them to know that we do have the providers available to help them through these situations.
That's interesting. And like you said, it's not that necessarily those urgent care or general practitioners want to, not treat anyone. It's just that your particular doctors are really trained and they work with these type of situations day in and day out.
Right.
So
right.
if it
This
comes
is all they do.
Right. So if it comes to the point where you have to go to court, they'll know kind of some of the steps you need to take along the way. And also there's the issue about a pocket expense, right?
Yes. So when you go to your traditional doctor, you have out-of-pocket expenses such as was your deductible met? Do you have a copay? And right now, with the way the situation is, a lot of people are out of work. We don't have the money to do that. In our case, we don't worry about that. There is no out-of-pocket expenses. As long as you were not at fault, our doctors will bill the person that hit you. They will bill your med pay if you have that available. If there's health insurance, we'll even work with that. And if you decide to bring an attorney on board, we work with the attorney. But those items are not required because you were not at fault, so someone else is liable for the accident.
Got it. Yeah, out-of-pocket expense, I mean, that's a real big deterrent, considering the fact that a lot of people aren't at work right now and you find yourself in a situation where you're talking about medical bills. Even when you are working, sometimes it's cost prohibitive,
Yes, and depending on the injury, the bills go anywhere from $1,000 to hundreds of $1,000s. So it's really unfair for someone to have to be responsible for those types of expenses when it's not something that they're responsible for.
Got it. Well, Daisy, again, with One Stop Medical, we appreciate you getting the word out and providing an alternative resource for those if they find themselves in those particular scenarios and situations. So, Daisy, you take care, and I'm sure we'll see you again soon.
Thank you. Have a good one.
You too.